AI is that technology that is changing every aspect of our life. Whether it's work, family, or even shopping, AI is playing a role. It is a transformative technology that is changing everything we do, and it is changing the world in ways we don't expect it today. We are at the cusp of this evolution in healthcare, and there is an opportunity for us to change how healthcare is going to benefit humanity going forward. Healthcare is going to use AI, and we can change it for the better. If we have to do that, we need to understand AI. We need to understand how it impacts healthcare. I am Krish Subramanian, CTO and co-founder of Hikigai. I have a passion for using transformative technologies to change healthcare, and that's what we are doing in Hikigai. I have more than 20 years experience on cutting-edge technology, building products that are transformative. Now I am focused on leveraging AI to transform healthcare. Hikigai is part of this transformative ecosystem of startups that are leveraging AI and changing every aspect of life. We are going to help doctors, other healthcare stakeholders, patients leverage AI so that healthcare is more beneficial to the society. In this video, I'm going to talk about how AI is reshaping healthcare. This understanding is critical if you want to change healthcare for the benefit of humankind. Let's talk about it. AI is reshaping healthcare, especially the patient-doctor interactions. It is helping doctors precisely find out what is happening to the patient by leveraging the 360-degree view of patient's health and giving doctor accurate insights into what is the real problem. With additional insights, doctor could precisely figure out what is the root cause of the problem and then tailor the treatment personalized for the patient instead of taking a more generic hands-off approach, which is usually taken in modern medicine. This personalization of medicine and treatment will help change how healthcare is delivered for patients. AI plays a very critical role in this personalization. It can look at all aspects of patient's health. It can leverage contextual data. It is not possible for the doctors to get to this level of detail during the 10 or 15 minutes they spend with the patients during their encounters. But by leveraging AI and feeding all the relevant patient information, not just clinical data, wearable data, environmental data, social data, financial data, anything that could impact the health of the patient, if it is available to the AI, it will help give precise insights about what is impacting the patient. This approach allows doctor to not only accurately diagnose the ailment, but also helps personalize the treatment for this patient so that patient gets the exact treatment that attacks the root cause of the problem. Generative AI and traditional predictive AI methods are playing a critical role in tailoring towards personalization of medicine. Doctors can leverage this to get to the root cause of the problem faster and spend their time talking to the patient and understanding their problems and being more empathetic. One of the biggest issues facing the clinics and doctors is all the grunt work they have to do. This takes away critical time of the doctor from dealing with the patient and understanding the patient. What AI can do is remove all these grunt work, which is impacting the doctors, and help automate everything from documentation in HR systems to ordering medications in the pharmacy to ordering lab tests to filing claims and catch it. If the claim gets denied, it will be automatically appealed so that the clinic or hospital don't lose out on getting the reimbursement. This helps clinics and hospitals get better efficiencies and better ROI, which is not available today. However, we should also keep in mind that AI has its own problem. there could be issues related to bias. AI is trained on the data from the real world. Real world is full of biases. And AI is developed by human beings, and human beings have their own biases. So bias creeps into anything AI does, and we should have guardrails to stop these biases from impacting healthcare, impacting the treatment of patients, impacting how billing and claims are done. So it is important that there are guardrails that stops any kind of bias from creeping in. It is not an easy problem, but many companies and startups are attacking this problem, and Hikigai is one of them. With the right guardrails, all these biases can be kept at bay, and we can reap the beneficial effects of AI. Another issue is privacy. In terms of training the AI and in terms of giving the insights, patient data is being used. Healthcare data is not something we can handle it in a loose manner. We need to make sure that the privacy of the patient is protected. How do you do that? Proper guardrails are critical, proper policies are important, and any technology you use should be HIPAA compliant so that we can do our best to protect the privacy of the patients. Bias, privacy, and the cost, which is exorbitant. Right now, all major cloud providers and AI providers are subsidizing AI. However, it's not going to go on forever. The cost is going to increase. So it is important that the AI models that are being used are cost effective. The technology that is being used, the way it is prompted, the way you get the results from AI are all cost effective, and that cost effectiveness is eventually translated to hospitals, clinics, and eventually to the patients. So controlling the cost of AI is another important thing. Any company building an AI product should take into account, and that has direct impact on healthcare. Today, cost of healthcare is out of control. If AI cannot control the cost of healthcare, it is of very limited use. So we need to make sure that the cost of healthcare is taken care of. Today, we saw how AI is reshaping healthcare in terms of helping doctors tailor their diagnosis and treatment to personalize for a particular patient and attack the problem at the root cause. We also saw how AI can take out the grunt work of doctors and clinics so that they have time to be more empathetic to the patients. They can reduce the cost of the healthcare and help patients get better healthcare at a cost-efficient basis. AI can be very useful. AI can be very transformative, but you need proper understanding of how AI is reshaping healthcare. Without that understanding, any tool you use will be suboptimal to your organization or to your patients. I hope you find this video useful, and you will come back and listen to all our future videos. Thank you very much. I'll see you in the next video.